This is LiveWell Talk on new Clinician Spotlight. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Well, we have another episode of meeting a new clinician that's going to start with the cardiology team. Her name is Amy Vincent. I've known you for a long time, and but our listeners need to get to know you and what services you're going to be providing, and what are your interests, and you know, I know you're a great person, so now you got to convince the listeners.
Well, thanks for having me. I appreciate it.
Now, I remember when you started back on when I came to town in 2005, you were on 3 Center.
Correct. Yeah.
So what got you to 3 Center?
So I went to school at Kirkwood for my ADN or my RN. Prior to that, I was working in ICU as a tech or nursing assistant. Yep, a couple of years before that. And so then I kind of knew cardiac was kind of like what I wanted to kind of go into. I kind of saw with like hearts and stuff in the intensive care unit. So I was offered a job on telemetry as a new grad, and I was there for quite a while, 7 or 8 years as a nurse, something like that. So I really enjoyed that time. Then I kind of went and did a few other things. I worked in PACU or recovery. And then I actually went over to the heart care clinic where I'm at now and was there for 3 or 4 years as a nurse over there.
And then I should know the answer to this because I know I wrote you a letter of reference at one time. But what Alan, right?
Correct.
Yeah. Okay.
Yeah.
That's what I thought.
Yeah. Yep.
How was that? I mean, do you think, did it complement? I've often thought, you know, if I could go back to medical school and I knew what I was going to do, would it been different? Would I have been like, okay, I'm going to, you know, study this and this? I mean, so when you started to go to the ARNP, you said, I'm going to stick in the cardiac world. Yeah.
Well, kind of. So I went the family practice route. There's different routes you can go with the family practice. You can obviously go into like subspecialties or specialties. So I didn't know kind of like what the job market was going to look like. I've always, you know, eventually thinking I want to do cardiac at some point, but they actually had a job opening. So I was fortunate. And it's actually, I'm going to be working in the EP area.
Oh man, they have a lot of gadgets.
Yeah.
We've done a couple podcasts about the advancements being made there, so that's pretty neat.
So I'm very excited.
Well, so you're from Cedar Rapids.
I am, born and raised. Yep.
Were you born here?
Mm-hmm. Yes.
You were born here?
Yes,
Wow.
I was.
You're kind of Mrs. St. Luke's almost.
Yeah.
We probably should cover the fact that you met your husband here as well.
I did. We worked on telemetry together.
Yeah, Adam.
Yep.
Yeah.
He was an EKG tech. Yep. So, yeah.
I remember those days.
Those
are fun times.
It was. We had a lot of fun.
Yeah. Things seemed easier back then.
Oh, they did.
Did they?
Yes.
I don't
they
know
really
if that's
did.
As you get older, you reflect on that.
For sure. Had a good group of girls and guys there. Yeah.
So EP, electrophysiology, pacemakers, etc. Had you had any previous interest in that, or this is just kind of where you could fit into the clinic?
Yep, kind of where I could fit in.
Okay.
And I'm excited. Like, it makes me a little nervous. You know, it's definitely EP is very complex, but we have a really good group going and we've really expanded. So they're, you know, needing more. So I'm also as well, in addition, going to go to outreach and do EP like in Manchester and Anamosa.
Okay.
To kind of free up our providers so they can be in the labs more. Yeah. And then I'm also going to help out in general cardiology on the inpatient end as well when needed, when those NPs are off. So it's kind of nice. I'm getting a little bit of everything. Yeah.
And with our new heart care expansion, we're going to get a second EP, right? So that'll expand that service there.
Right. So
I know you had an interest in cardiology. You're on the telemetry unit. Now you're an EP, but there has what motivates you to want to do this job, to want to be in healthcare?
So I've always known that I've wanted to do something in the medical field. Like, I've always loved science, always wanting something where I'm helping people, taking care of them. I love interactions with patients. I love learning, and kind of it incorporates it all together. I just love building those, you know, relationships and rapport with patients, trying to help them.
Yeah, that is the most rewarding part.
Yeah.
Some days I think to myself that if everything goes smooth in the day, you know, they didn't need me. But if there's
Right.
like, the days that
Right.
are your worst days where you just,
Right.
it's just putting out fires
Right.
and
Yes.
you get home late, but they're also the most satisfying days. It's a
Right.
weird trade-off.
Yes.
I mean, I don't,
I agree.
I think listeners that listen,
Yeah.
listeners that are in healthcare are going to,
Right.
relate to that.
For
but
sure.
Maybe
For
not
sure.
in other jobs.
Yeah. No, I
What-
would agree.
How would you describe yourself to your patients?
I'd say I'm pretty chill, pretty easy to get along with. I'm pretty open, honest with them. I feel like I'm easy, for them to. I like to listen to, their concerns. Really try to, figure out how I can kind of make their lives better. Kind of what is, whatever may be that they're being seen for.
Yeah. Because you're going to have to be. I think there's going to be a lot of bridge in communication for you. This is just my take on it.
Yep.
I mean, electrophysiology is kind of complicated for me.
Right.
Imagine a patient
Correct.
that doesn't know anything about
Exactly.
healthcare.
Yes.
So you're going to have to be the bridge to get them on the same page, which I think is phenomenal.
Yeah.
And
Yep, definitely.
I mean, you watched me be a doctor earlier in your career, so you've got an excellent role model to live up to, right?
Yes,
So
I do.
You're a good person.
I do.
Amy. You're a good person. Well, I your son's probably about 8 or 9, 10 maybe.
13.
13? Wow.
I know.
You are getting old.
I know.
I can't believe that.
Yeah.
13.
13.
So is that 13 middle school?
Mm-hmm. He'll be in 8th grade.
At which one?
Harding.
Harding. Is that
Yeah.
where you went?
Mm-hmm.
Yeah, I went to Harding too.
Did
Harding
you?
Chargers.
Yeah. Yeah.
That's just small
It
world.
is crazy. He'll be driving and everything. But
Is he getting tall like Adam?
oh yeah.
Yeah.
He's probably a hair taller than me. I'm 5'7", so
Yeah, for listeners that don't know her husband, Adam, he's like what, 6'5"?
Yeah.
He's a big guy.
yeah. Yeah. So
So what do you enjoy to do when you're not in healthcare?
well, finally,
you're
since
free.
I'm done with school, it's like, actually I can breathe and have a little bit of a social life again. Just being with friends and family, vacations, trying to hopefully get back into running. I did a couple half marathons in the past, so
Oh, wow.
I'd like to kind of not work back up to that, but at least, start doing a little bit of that again.
I can appreciate working full time and going to school. That seems like a really
Yeah.
difficult thing to do. I was lucky, if you will. I mean, I had scholarships and didn't have to work full time
Sure.
during medical school or even undergrad.
Yeah,
But I also think that kind of gives you great time management skills.
I would agree with
I think
that. Yeah.
you definitely
Yep.
see the physicians and
Mhm.
the nurses that have either a family commitments or
Right.
that they tend to manage their time a little
Right.
bit better.
Yeah. Work full time, then they've got
Yeah,
kids running around
Yeah.
and yeah.
I used to say I had a 4.0 every fall semester and then dropped to 3.5 every spring because I didn't have football. With football you're like, okay,
Right.
I have to get this done because
Yeah.
we travel away this
Sure.
weekend. So, but then in spring you're
Right.
like, yeah,
That makes
Saturday Dustin will take care
Right.
of it. Yeah, he doesn't. This,
Right.
this Tuesday Dustin doesn't need to worry
Exactly,
about it.
exactly.
So,
for sure.
well, Amy, this has been great talking to you.
Yeah,
And,
you
and
too.
as listeners can tell, I've known you a long time, and I've always liked working with you. And
Yeah.
I'm excited for you. I think you're
Thank
going to bring
you.
a lot to the table.
Thank
I
you.
know you're being a little shy with us today, but I know that you're a good person. You care
Thank
about
you.
people.
Well, I
And,
appreciate you guys inviting me on.
I will. Once again, that was
Thank you.
Amy Vincent, a nurse practitioner at St. Luke's Heart Care Clinic. She'll be joining the electrophysiology team. If you're interested in scheduling an appointment with Amy, call St. Luke's Heart Care Clinic at 319-364-7101. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.